Hi friends, wondering why sports players get a lot of sports injuries? Well, myself Dr. Ameya Velingker, I'm speaking to you from the Sports Center at Bone and Joint Care, and Goa, as you know, is a land of sports. We are full of football, basketball, volleyball, and these are a part of Goa life. And at the center today, I want to brief you why are sports players more prone for getting sports injuries. The most important sports in Goa, football, in the heart of every Goans. Second, the basketball. You can go to any beach in Goa and you'll see a basketball, the beach basketballs. Third injury, tennis, badminton. These are all sports called as contact sports. Now what happens? Why do we get so much of sports injuries? Let us break down into football. Football, as you all know, we need to twist, we need to spin, we need to dodge the player opposite to you. Because winning a game is the most important thing. It is not the only thing. Basketball. When we play basketball, as we all know, that's a time when you land on the knee. Your knee spins a couple of times. The ligaments injure. Does not matter. We are there. And at the Sports Center in Bone and Joint Care, we can fix any ligament for you and see to that you can achieve your goal. So, what are the injuries which I generally see in my sports center? Most common surgery which I perform is the ACL. What is ACL? Come on friends, this knee, as I can show you, has a ligament, one on the inner side that is called as MCL. This is LCL. You flex the knee and you have a ACL, and you go turn around the knee and you have a PCL. These are the four ligament ligaments which together stabilizes your joint in all directions. Most of the time, when you try to dodge your opposite player, you tend to spin your knee, and that's the time when you get this out. So you get most of the time a simple ACL injury, but in today's velocity of sports which you see in Goa, you will get a MCL, you will get an ACL, you can get a medial meniscus tear also, which is one of the most common 3 injuries which happens for a football player. At our center, we almost perform a surgery every day because football is in the blood of every Goan. The second sports, the basketball. You jump, putting the ball in the goal is the most important thing. And winning the game is the most important thing. And many a times when the player lands, he spins the knee. Accidents, can't help it. But when you spin the knee, you tend to damage one or the other ligament. But don't worry friends, we can fix it up for you. And you are not losing the sports. You will definitely play better than what you were before. Third common sports in Goa is badminton, tennis, and nowadays a lot of pickleball. All these things, most of the time people get a tennis elbow. Mind you, tennis elbow is not seen in professional tennis players. It is seen in beginners who learn the tennis. The reason is a tennis elbow is basically an avulsion of your ligament out from the bone. And this can happen when your muscles are weak, not when they are strong, and not when you are professional. Now, another important sports injury which we have is a shoulder dislocation. It is not just a sports injury. You may sometimes fall in a manhole. You may fall on the road and your shoulder can come out. But most of the time, while playing sports, like a football player tries to hold your hand and pull you behind, you can get a shoulder coming out. It can happen when you're very intense into a basketball. So, shoulder dislocation, one of the most common problems which we see in a shoulder injury, and we do a surgery called Bankard's repair. To repair, we put some anchors and we fix it up and get back to sports. So what you should do? If you at all have an unfortunate fall, a swelling on the knee joint, a shoulder joint, or a tennis elbow swelling, first thing you should do is ice pack it. Cool it down. If you find the knee a little bit loose or very unstable or painful when you bend the knee, meet us and we will have to do some MRI scan and X-ray to find what injuries you have gone, and this will further lead to maybe some small keyhole surgeries, and you should be back to your favorite game like ever before. If you like this video to be more informative, do subscribe us and we'll give you a frequent updates.